Hi, everyone. Welcome to this month's Tumolo Talk. My name is Alyssa Tumolo. I am a licensed insurance agent who specializes in Medicare, and so that's why I'm here. It's Medicare season. It's the annual enrollment period, which runs every year from October 15th to December 7th, and we get a lot of Medicare and healthcare questions this time of year. So that's why I'm here doing this Tumolo Talk. And today we're going to focus on some common Medicare mistakes that people make, and we want you to avoid making them. So let's get started. So number one really common mistake that people make is they incur penalties that they could have avoided. So Part B and Part D of Medicare can both subject you to penalties. Part B is your outpatient medical insurance, and the penalty if you don't have Part B when you were first eligible, and if you don't have creditable coverage, it's 10% per 12-month period that you didn't have that coverage. So for a lot of people, you're 65, you're still working, you won't necessarily be subject to this unless your employer coverage isn't considered creditable. So I tell people just go to your HR benefits department, ask if your coverage is creditable, ask for a letter that says that it is creditable for Medicare Part B, and that way you have that documentation for later down the line when you want to go on Medicare. If you are 65 and you don't have other creditable coverage, you do want to enroll in Part B right away to avoid this penalty. It is a lifetime penalty. It doesn't go away for as long as you have Part B coverage. So you want to make sure to avoid that if you can. And the other thing that I've run into recently is that people think that COBRA coverage is creditable because a lot of times it's your retiree or employer group that will provide that COBRA coverage for retirees for a certain amount of time. It's not creditable coverage for Part B, so you would still incur that penalty when you do go on to Medicare. So just something to be aware of. Now, Part D is your drug coverage. The penalty for this is 1% of the national base premium, which in 2023 is $32.74. And for the penalty, they take 1% of that number and multiply it by the number of full uncovered months that you didn't have Part D or creditable coverage. So a lot of people, this is kind of a common misconception. People think, well, I'm not on prescriptions, so I don't need drug coverage. And I usually tell people, it's best to have that coverage right off the bat, because if later on down the line you start going on more prescriptions and you want drug coverage, you're going to incur that penalty for the amount of time that you were eligible for Part D but didn't have the coverage. So best practice is to just have that coverage right off the bat so you don't have to, spend that money later on the penalties. Another thing to be aware of, and another mistake people make, is not accounting for income. And so a lot of people don't know that Part B and D are based on your income levels, and what is called the income related monthly adjustment amount is also called IRMA. And these are the levels for 2024. And the IRMA goes off of your tax return from 2 years ago. So in 2024, it will go off of 2022's tax return. So you can see the levels here. The first level is if you make less than or equal to $103,000 filing single, or less than or equal to $206,000 married filing jointly. So your Part B premium would be $174.70 per month. You can see that IRMA adjustment amount gets added on if you are in any of those levels from going up from there. So if you're in that next level, which is single between $103,000 and $129,000, or married and between $206,000 and $258,000 in 2022, then they're going to add on $69.90 to that original premium, and it goes up from there. So it's just something you want to be aware of. This is something we're hyper aware of when doing Roth conversions and things like that. Ken and Nick are aware of if it's going to, jack up your Medicare premium, because that's something we want to be aware of and not do. So it's something we can help with and something we can talk through here with the team. And the last mistake that people make is not evaluating their options. plans change every year. Your circumstances might too. So you might have changed doctors or prescriptions. And so you want to make sure every year that those new benefits with the plans still fit your circumstances and that you're still on the most suitable plan for you. So it's something that you can sit down and speak with a broker with, and they can answer your questions and give you your options and explain them and talk them through with you. So how we can help, that's something I can do with you. I can answer your questions. You can either call or we can sit down and do a in-person Medicare review appointment. I can come to the Middletown office or I can do this in the East Lyme office. And I'm happy to sit down with you, answer your questions, talk through Medicare and your options. So thank you for watching. Like the video, share it with anyone that you think might find it helpful, and I look forward to seeing you soon.